Good morning, YouTube. Welcome back to our YouTube channel. This is Miss Henderson. Today I'm teaching a home health aid class, and today we are doing something exciting. We are going to be doing a partial bed bath for a patient. I'm going to ask one of the students, Miss Michaela, who is a home health aid student. She's very, very methodical with the scale and very, very professional. I'm gonna ask Michaela to do the scale. Again, if you like these types of content and these types of educational material, please consider subscribing to our YouTube channel. Please drop your comments below, and please give this video a thumbs up for my home health aid students. Go ahead, Miss Michaela.
Okay. Okay. Hi, can I come in?
Yeah.
Good morning. My name is Miss Michaela, and I am your home health aide today. I looked at the schedule. Graphics, please. Could you please tell me your name?
Jones.
Miss. Okay, great. And your date of birth?
January 1st, 1950.
Thank you so much. Perfect. I'm going to put on my gloves here. I'm going to check the bed to make sure that it's locked. The wheels are locked. I'm gonna put down the side of the rail here. I'm going to raise your bed, Miss Jones, to a 30-degree angle because I'm going to get ready to wash you. I'm going to put my bed into working level position so that it's comfortable for you and me to perform this process.
So Michaela is introducing herself.
Just start. Now, I'm going to bring over my little table here so that it's more convenient for me to begin the process. Now, Ms. Jones, I'm going to put the privacy blanket on you.
So Michaela is providing privacy for her patient by providing a privacy blanket to keep her patient warm and comfy.
Yes, to keep you warm, Ms. Jones,
And
comfy and
provide
protect your
additional privacy.
during this process. I'm going to fan fold your sheet so that I do not get it wet during the wash. I'm also going to provide additional towels by your hand side. Put the call bell on your left side and put additional towels lifting your arms.
Those are
I like to do it this way. Same thing, 4 corners just in case. Dip it into water, put some soap, and continue washing the torso, under the breasts, and the abdomen.
As you can see, Michaela is providing privacy for her patient. She makes sure her patient is well covered. She's trying to maintain the privacy of her patient, which is
on the sides of the body, from the sides, going over to the arms, upper arms, and the wrist, hands, sliding upwards, and last part would be the armpit. Get a new cloth, damp it into water, and rinse off the soap. Same thing. Torso, breasts, abdomen, sides, arms, wrist. Dry the patient completely from any excess water. Gather yourself a clean gown for the patient. Slide in the arm gently. Lift the privacy blanket. Put the gown under the privacy blanket for the patient. Mrs. Jones, on a count of 3, I'm gonna raise you. Actually, wait. I'm sorry. I don't need to tie her right now. I'm going to go over to the other side with the same washcloth. I'm going to change the water, yes.
yeah, the water gonna be changed,
Yes.
and this side rail is gonna be drawn up.
I'm so sorry. It's okay. I'm going to for safety. And I'm going to walk over to the left side, drop down the rail, change the water,
And also your gloves.
and also my gloves, yes. I don't know why it keeps falling. I'm going to change my gloves. I got fresh water. Mrs. Jones, I'm going to wash the left side of your arms. So I'm going to gently just roll off the dirty gown. Pull that out, roll it into a ball, and dispose it into the linen. Let's say there is a dirty linen.
Dirty
box
hamper.
here, dirty hamper, and I put the gown.
Hello guys, good afternoon. Today, welcome back to my YouTube channel. Thank you again for tuning in. If you're new to this channel, welcome aboard, welcome to this family. And if you like these types of educational material, please give me a thumbs up. And please subscribe to my YouTube channel. I come every so often. I upload new content twice a week on different educational material. So please subscribe to this channel. Please give me a thumbs up. Please like and share these videos. So today I want to talk a little bit about the state board exam for the certified nursing assistants. So in order to be a certified nursing assistant, you must complete the didactic component and school, a licensed professional school. You must complete the didactic, and you also must complete the clinical skills. So when you complete CNA school, you will be eligible to take the state board exam to get your state board certification. So the state board certification consists of two components. You have a didactic aspect where you're going to be taking questions on a computer, and you must pass the didactic component. Then you'll move on to the clinical skills. So the clinical skills, you have to complete 3 skills, and those skills will be chosen by the proctor, whoever is giving you administering the exam. You will be completing. They'll give you 3 skills. It could be hand hygiene, it could be transferring a patient from a bed to a wheelchair, or it could be ambulating a resident with a gait belt. So regardless of any skills you get, you have to do certain things. And today I am going to explain the indirect skill that you need to do for each one of these skills. I have them written down on my computer here. So I am going to be looking down here, and I'm going to be reading some of these skills. They're called the indirect skill before you actually get to the direct skill. So that makes sense in any way? So the first one is to greet the resident. Address the resident by his or her name and introduce yourself. Tell them what's your name. And the second one is to provide explanation to the resident about the care before beginning and during care. So just don't go there and start doing foot care then. Tell the resident, explain to the resident, Mr. So-and-so, I am here to provide you with mouth care. So you explain. That way it will decrease the anxiety of your patient or your resident. They call them residents in the nursing home because they live there for 24/7, and they call them residents. So explain exactly what you're there for. So the third element of the indirect skill is to ask the resident about any preference during care. So by asking the resident of their preference during care, you're promoting comfort, and you're making the resident feel like, you're showing empathy and you're being compassionate as a nursing assistant. The fourth element is to use standard precautions and infection control measures when providing care, before and after. So you know, before you perform your care, you know you have to perform hand hygiene, because you were taught that during nursing school. You were taught to perform hand hygiene, washing your hands, using soap and water for 15 to 20 seconds. So you must perform hand hygiene. That's practicing good infection control. So the fifth one is to ask the resident about comfort or need during care or before or after care. How do you promote comfort? Ask the patient, are you in pain? You can use pillows to promote comfort also. You can give them a back massage. So you have to ask them about anything that is in, are you experiencing pain? And you know, that way you're showing that you're promoting comfort and you're being empathetic. And the sixth one, promote resident rights during care. How do you promote residents' rights during care? That's a sixth element of the indirect care. You're promoting residents' rights during care by pulling the privacy curtain. Maintain the patient privacy during care and after care. That way you're promoting the patient's rights to privacy. The seventh element is to promote the resident's safety during care and after care. How do you promote a resident's safety during and after care? For example, you're promoting safety by raising the bed to working level. You're also maintaining proper body mechanics. When you're leaving the residence, you make sure you're leaving the bed in the lowest position. You're putting the call bell within close reach. That's the way how you are promoting safety during and after care. So guys, these are the seven components or seven elements of indirect care. If you are taking the state board exam, make sure you integrate these seven elements of indirect care, so you can because you're judged by the indirect scale and also the direct scale. So integrate these seven elements in your indirect care, and that way you can optimize your chances of passing the state board exam. Again, if you like these types of videos and these types of content material, I upload new content twice a week. Please consider smashing the subscribe button, like and share these contents, and drop your comments below. Let me know what else you would like me to provide you with. Thank you so much for watching. Thank you for my subscribers. If you're new here, please consider subscribing to this channel. Thank you so much, and I'm out. Bye for now.